Hi, my name is Dr. Stephanie Saucier. I'm a board-certified cardiologist and a lipid specialist, and today we're going to be talking about coronary artery calcium scores. So let's dive right in. If you want to learn more, make sure you hit the link below and get a free copy of my Heart Health Guide. What is coronary artery calcium score, or a CAC test? Well, a coronary artery calcium score is a really simple test. It's a CAT scan where we look and see how much hard plaque has deposited into the coronary arteries. If you remember, the coronary arteries are the arteries that supply the muscle of the heart with blood. And when plaque builds up in those arteries, this is called coronary atherosclerosis, or coronary artery disease. And so a calcium score, or CAC test, gives us a number of how much plaque is in each one of those main coronary arteries. Why did my doctor order a coronary artery calcium score for me? Well, your doctor may have ordered a coronary artery calcium score for you to better risk stratify you from a cardiovascular risk standpoint. Or they might have ordered it to see, based on your risk factors, have you already laid down or developed coronary artery disease or atherosclerosis? Again, the calcium score test is really easy. It's a quick CAT scan, takes about 5 minutes, but it shows us how much plaque is already developed in the arteries of the heart. What does my coronary artery calcium score mean? And what's a good score versus what's a bad score? Well, a coronary artery calcium score, as I mentioned, all it tells us is how much hard plaque is in the arteries of the heart. It doesn't tell us about soft plaque. And so your score, you're going to get two different scores. You'll get a score of a number. Your coronary artery calcium score is XYZ. And then you're going to get a second score that compares you to patients, your gender and your age. So for example, you may get a coronary calcium score of 100, and then your next score will say this places you at the 50th percentile for patients age and gender matched. Now, what's a good score? A good score is 0, right? We want no plaque in the coronary arteries, or no hard plaque in the coronary arteries. So a calcium score of 0 is actually very prognostically good. Now, there are caveats to when a calcium score of 0 doesn't mean as much protection, and that's if you have diabetes that's not well treated, a strong family history, or if you're a smoker. Now, what about a bad coronary calcium score? If your coronary calcium score is elevated more than 0, then we also are going to look at what percentile you come into. If you're within the 75th percentile, that places you at elevated risk for having heart disease in the future, or a cardiac event in the future. And so we really want to modify your risk. Now, if your calcium score is more than 400, we consider that to be severely elevated coronary calcification, and your doctor may order follow-up tests, such as a stress test or some other form of testing to see if the plaque that you have is causing a significant blockage in one of those arteries. So there's a few numbers to take a look at: your total calcium score, your percentile compared to patients, your age and gender, and then also kind of your overall picture. And so your doctor will take all of these things into consideration. We'll look at how much plaque is in one artery versus another artery, and we'll make recommendations on how we can prevent more plaque from building up. But these are kind of what make up your coronary calcium score results. Can I improve my coronary artery calcium score, or can I get rid of the plaque? There's a lot of lifestyle modifications that we can make to help strengthen plaque, make sure that it's more stable. Unfortunately, there's nothing out there yet that rooters the plaque away. Now, you may see things online that say, oh, this supplement gets rid of your coronary calcification, or this diet gets rid of your coronary calcification. And unfortunately, we haven't seen truly anything that completely in all comers cleans out that coronary calcification. So the most important thing that we can do is prevent more plaque or more coronary calcification from building up. And that may require us to start you on lipid-lowering medications, because a lot of these plaques are cholesterol rich. They're built off of high levels of cholesterol. We may or may not recommend a baby aspirin, but unfortunately, there hasn't been one single thing that gets rid of coronary calcification. When patients come to me with, oh no, I have an elevated coronary artery calcium score, what I typically say to them to put them at ease a little bit is, we have this knowledge. Knowledge is the enemy of fear. So when you know that there's something either wrong or developing, now we can take steps to make it better. We can take steps to prevent you from having a heart attack. We can make steps to prevent that plaque from getting worse. And I'm going to recommend that you live a healthy lifestyle, diet, exercise, take care of the blood pressure, cholesterol, no smoking, all of these things that we talk about kind of on a day-to-day basis. But knowledge, I think, is the most important thing. So I always tell patients, when you have a coronary calcium score, if it's 0, we're going to have great news. But if it's elevated, it's not the end of the story. It's really just the beginning of the story. And now we can really start managing and aggressively modifying your risk factors to make sure that you stay heart healthy for many years to come.